Hi, I am Dr. Ruchi Garg, Senior Consultant in Obs and Gynae at Cloudnine Hospital, Gomti, Nagar, Lucknow. Do you know which is one of the commonest cancers in women in India? It is the cancer of the cervix. Cervix meaning the lowermost portion of the uterus. Interestingly, it is also one of the few cancers for which a preventive vaccine is available. Also, there are available OPD-basis tests which can diagnose this cancer early on. So, let us increase the awareness towards the availability of the vaccine and the test for cervical cancer. Cervical cancer is caused by a virus called the human papilloma virus, and the exposure to this during sexual contact increases the susceptibility of these women to develop this cancer later on in life. And thereby, these HPV viruses have been used to form certain vaccines which can be given to the young girls as well as boys to prevent them from developing these cancers later on in life. The two vaccines which are available for prevention of cervical cancer in India, 4 and 9, meaning the number of subtypes of the HPV virus that are contained in those particular vaccines. The efficacy of these two vaccines are different and so are the cost. So we leave it on the patients to decide which one to pick. Interesting point to note is that these vaccines are also recommended for boys, as men are also known to develop certain cancers, namely cancers of the anus and the penile cancer, because of these viruses. The dose recommendations for these vaccines are different depending on the age group. It is important to understand what is the age recommendation for these vaccines. The earlier the vaccine is given, the better it is, because the exposure to HPV virus is through sexual contact. The recommended age is 9 to 14 years, while it can be given between 15 to 26 years as well. After 26 years, when given between 27 to 45 years, it is called catchup vaccination. But it is important to remember that during this period, the efficacy of the vaccine reduces. The dosing schedule depends on the age. So for 9 to 14 years, the dosing schedule is 0 and 6 months, meaning to say that if the first dose is given at a particular age of 9 years, then the second is given at 9.5 years. After 15 years of age, if it is given, the dosing schedule is 0, 2 and 6 months. It is important to note also that boys are also recommended to have this vaccine. Men are also prone to develop penile and anal cancers because of the HPV virus. Let us also understand that what are the tests that are available to make an early diagnosis of cervical cancer. These are OPD-basis tests, namely the pap smear test, HPV genotype test and the LBC. Depending on your age and depending on the test that you are choosing, you will be given a schedule when to repeat the test. Usually they are to be repeated every 3 yearly or every 5 yearly. So cervical cancer is a cancer which is easy to prevent and easy to diagnose early on, provided the awareness is adequate.